Hello everyone, welcome back to my YouTube channel. I am Dr. Dildar Hashmi and today we will discuss about the complications in infants of diabetic mother, right? So if the mother is diabetic, what are the chances of the complications that can develop in the infants, right? We will discuss all that in detail. So before starting the discussion, let's start with the mnemonic that can help you to remember all the complications easily. So the mnemonic is LCMRP, right? LCMRP. It will help you to remember all the points easily. So the first complication that can develop in the infants of diabetic mother will start from L. What L stands here? L is for large for gestational age. Large for gestational age, right? The infant would be large in irrespective of the or in comparison to the age of the gestation. Okay, so the infants would be large. The second complication that can develop will start from the C. C is for congenital. C is for congenital malformations. What are the congenital malformations that can develop in the infants? We will discuss that later once we will complete MRP. Okay, the third complication that can develop will start from M. M is for metabolic complications. Metabolic complications. So the metabolic complication that can develop in the infants is, the first one is hypoglycemia. Hypoglycemia in infants. The second complication that can develop is hypocalcemia. Hypocalcemia. Okay, so the first thing that is large for gestational age. So if the infant would be large, that means it would require more energy or more nutrition, so there is the chances of hypoglycemia, right? In the same way there would be hypocalcemia. The fourth complications that can develop will start from R. R is for respiratory complications. Respiratory complications. What are the respiratory complications that can develop? The first one is hyaline membrane disease. Hyaline membrane disease. Respiratory distress syndrome, it is hyaline membrane disease. The second complication, respiratory complication that can develop, that is transient tachypnea of newborn. What it is? Transient tachypnea of newborn. Okay, we will discuss all these complications in detail in upcoming lectures like hypoglycemia, hypocalcemia, HMD and transient tachypnea of newborn. We will discuss all that in the coming lectures, right? So this video is basically regarding the complications. If in any MCQ or in your university exam only the complications in infants of diabetic mother would be asked, you can write like this only. Okay, so the last thing that or the last complication that will be in the infants would start from P. P stands for polycythemia. Polycythemia, right? There would be increased number of RBC, right? The polycythemia can be due to renal vein thrombosis. Renal vein thrombosis. Next, the polycythemia can result from jaundice, right? So we have discussed up to here the large for gestational age, metabolic complication, respiratory complications, and polycythemia. So these are the disorders. Now let's discuss about the congenital malformation. What are the congenital abnormalities or malformations that can be there in the infants of diabetic mother, right? So the congenital malformations. Congenital malformations. Congenital malformations. The congenital malformations, the first malformation that can be in the congenital, that can be present in the infants, that is CHD, congenital heart disease. What is congenital heart disease? The congenital heart disease that can be present in the infants is ventricular septal defect. Ventricular septal defect, VSD, right? The second complications that can be present is the transposition of the great arteries. What it is? Transposition of great arteries, right? So the congenital heart disease, the first one is ventricular septal defect, second one is transposition of the great arteries, and third one, which one is the least common, that is atrial septal defect. Transposition of the great arteries, this one is the most specific complications. What it is? This one is the most specific. And least common is atrial septal defect, that is ASD. Okay. Some more congenital malformations that can be neural tube defect, like neural tube defect. Neural tube defect. This one is the most common, right? What is the most specific? That is the transposition of the great arteries. This one is the most specific and most common, that is neural tube defect. Okay. The next complication that can be present is caudal regression syndrome. caudal regression syndrome. What is caudal regression syndrome? There is lower part of spine is underdeveloped. So in caudal regression syndrome, right, regression is there, so the lower part of the spine, that is the caudal part of the spine, is underdeveloped, right? So this one is caudal regression syndrome. The next complications that can be present, that is small left colon. The left colon of the infant would be small, right? So what I am trying to say, from the congenital malformation, that is ventricular septal defect, transposition of the great arteries, and atrial septal defect. If we talk about the heart only, in heart, transposition of the great arteries is most specific, and atrial septal defect is the least common, right, in heart. And if we talk about the overall thing, except heart, so neural tube defect would be most specific, most common, and caudal regression syndrome, this one would be the most specific. In heart, what is the most specific one? Transposition of the great arteries, right? Rest, caudal regression syndrome would be most specific. If they are asking you about heart only, so you will mention that TGA, transposition of the great arteries, would be most specific. If they are not mentioning heart, then you can write caudal regression syndrome would be most specific, right? And neural tube defect is the most common one, right? What we have discussed up to here is the complication in infants of diabetic mother. The first complication would be large for gestational age. The second complication is congenital malformations. Third complication is metabolic complication like hypoglycemia and hypocalcemia. The fourth complication is respiratory complication like hyaline membrane disease and transient tachypnea of newborn. The next or last complication is polycythemia that can be present in renal vein thrombosis and jaundice. In congenital malformation, ventricular septal defect, transposition of the great arteries, atrial septal defect, and other like neural tube defect, caudal regression syndrome, and small left colon can be there in infants of diabetic mother. Okay, this is all about this video. Thank you everyone for watching. Have a great time. Bye bye.